Those potholes can be a pain in the neck, and that pain in the neck just might be a real pain in the neck, but you don't have to live with it, because at Oklahoma's Spine and Brain Institute, they can diagnose your condition and deliver the highest quality neurosurgical care possible. Dr. Frank Tomecek joins us this morning with the information that can help us all rid ourselves of a pain in the neck. Doctor, thank you so much for coming in this morning.
Oh, you're welcome. My pleasure, Mark.
A lot of people experience neck pain. Where do most of the symptoms originate, or how are they caused?
Well, usually neck pain is related to muscular tension and ligamentous irritation and injury caused sometimes by minor traumas. So most people will get better with non-surgical treatments like physical therapy, chiropractic, traction, massage. Sometimes, though, they'll have some irritation to the nerves, and then they'll have radiation of pain down the arm or into the shoulder. And sometimes they won't get better with these non-operative treatments over time, and they'll need additional things like injections of steroids in the neck, which is another option. But when those things all don't work and a person's been suffering with pain for several weeks, that's where I can come in and be more effective, and we might want to do a lot more investigation as to why the pain is occurring, because there are other things that can cause pain, like herniated discs, which are the cartilage between the vertebrae that allow the spine to move. If the disc ruptures against the nerve, sometimes it won't heal with non-operative treatment, and they will require surgical treatment. Other things that can cause neck pain include tumors of the neck, which are pretty rare compared to the other causes, and fractures of the neck. But certainly we have plenty of tests like CAT scans, MRIs, and other tests that can investigate those problems if you have ongoing problems and pain, and get a diagnosis.
Now, you brought some examples here today of the spine and the neck. Where can you point to me where exactly the problems exist?
Yeah, well, usually a patient is going to have, if they're going to have a herniated disc, you can see that on this model, for instance. This is the cartilage between the vertebrae, and that disc, which is part of the cartilage, can tear and pinch the nerve against the bone. Normally the disc is in the front of the neck, that you can approach through the front of the neck, and that disc can be removed and taken off the nerve if non-operative treatment doesn't get it to heal. Some of the devices we use now, we have all kinds of options in this day and age. I can't tell you, I've been practicing for 15 years, and the technology has changed incredibly over 15 years.
Now, what is this?
This is a model of two different approaches through the front of the neck. One is a cage that you can put in where the disc used to be to keep the vertebrae stabilized.
Gotcha.
Another is a plate that will hold the vertebrae together and replace the loss of the disc. But now, in this day and age, over the past couple of years, we have an artificial disc, which we didn't have before, that allows these other options that you can treat for 1 or 2 level neck herniated discs, or even 3, involve fusing the neck and immobilizing it. But we have now options that allow motion to be preserved, motion sparing operations, so that all patients that have spinal injuries don't necessarily need to have their spine fused. They can have a mobile device that still allows motion of their neck in all directions to keep them from not being able to turn or look up or work in different positions. So there's a lot of options now. I mean, the artificial disc isn't for everybody. Many do need to have their neck fused. Some need to have the treatment done from behind. Most of these approaches are actually through the front of the neck through a very small incision. Some people have fractures or different injuries that involve bone spurs that pinch the nerves, and to get to them we have to go from behind in the neck, and sometimes we put tiny rods and screws in from behind to stabilize the neck.
I've only got a few seconds left, but I want to ask you recovery time for this type of procedure. How long are you looking for?
Well, usually for the artificial disc, you're talking about just a couple of weeks recovery. For fusions, you're looking at anywhere from 1 to 3 months, depending on how many disc spaces need to be fused and from what approach you're doing. So it can take, you know, you can be off work for a couple of weeks or less, or you could be off work for a couple of months, depending on the severity of the problem and what needs to be done.
I think the best advice would be to contact you for, of course, follow-up visit and find out some more information. If you want to call them, they have numerous locations. Oklahoma Spine and Brain Institute, 6002 South Olympia Avenue, Highway 75 and 71st Street, 749-0762. OSBI.net for more information.